first things first, welcome everyone. It's lovely to be presenting and involved in this discussion. As a way of introduction, I'm a paediatrician with a special interest in genetics. I do some research with the Melbourne Genomics Health Alliance. I'm a clinical educator, and one of the clinical things that I do is I am lead clinician for what we call the Paediatric Exome Clinic at Monash Health in Melbourne, where we have a paediatric clinic where kids and families are referred to chat about and to facilitate genomic testing. So I'm going to pass over to Erin to introduce herself now.
Thanks, Emma. Hi, I'm Erin. I am a PhD student with the Melbourne Genomics Health Alliance, and I'm also with the University of Melbourne and Murdoch Children's Research Institute doing a PhD that's finding out about the supports families need as genomic testing starts to be delivered in different settings, so by paediatricians and not just in clinical genetic services. Thanks, Emma. Back to you.
Thanks, Erin. Okay, so the clinical educator in me wants to know learning objectives and wants to set that out. If anybody has anything else that they would like to add to this list, feel free. We're doing a really flexible, open-ended presentation tonight. So happy to take the discussion in whatever way everybody would like to take it. But what we've identified as some learning objectives that you might choose to get out of today is to learn a bit about what is genomic testing, what are the benefits of mainstreaming genomic testing, and what we're specifically focusing on today is paediatricians arranging genomic testing for children with a suspected childhood syndrome. We'll also talk a bit about resources for support to order the test and ways to enhance a family's experience of genomic testing. So for those who haven't come across genomic testing before, we've got some definitions there. I did have a quick look in the chat about the areas of practice that many of you are in, and these terms will be really familiar to some. But if not, I'll give you a minute just to have a read. So when we talk about genomic test, we're talking about exome sequencing and genome sequencing, and that's up there. So some things that we've heard at Melbourne Genomics through our research that families have experienced with genomic testing is that in the past there have been long waits for appointments and long waits for results. And one of the reasons is that in the past these tests have been requested only out of genetic services rather than more widely available. And therefore they have been somewhat difficult to access. So we'll just ask for no recording of this slide. And we've got some quotes from families. Erin, I'll hand over to you. This is from your work.
Thanks, Emma. So, as Emma said, in the past, it's been really hard for families. They've often had to wait a really long time in order to get a genetic diagnosis. And these are some quotes from what parents have told us about this long journey for them. And in particular, parent two on that screen, you can see that some of the, they reflected the benefits of having an earlier diagnosis is that families have a better understanding of what's going on for their child, as well as perhaps avoiding some tests that might not necessarily be that could potentially be avoided had genetic testing been organised earlier on.
Okay. That leads us to how things are changing, and we hope are changing for the better. So, in the last few years in Australia, Medicare funded genomic testing for childhood syndromes has been introduced. And that talks about federal government funded genomic testing for children who meet eligibility criteria, and we will go through that in more detail a little bit later on. But the important things to know is for children who are less than 11 years old at the time of testing, and when a monogenic condition is suspected, so that's a condition that's caused by a change in a single gene. And this testing is funded for paediatricians to order it. So general paediatricians, specialty paediatricians, which is great because there are lots more of us than there are clinical geneticists. So hopefully that leads to increased equity of access. Brings us to our next point about what some of the benefits are of this new initiative. And you can see we've divided it up into patients and families, paediatricians, and the healthcare system as a whole. And obviously you can all read the slide, but I'd just like to highlight some key points. What we know from our work with families is that the relationship with a known and trusted clinician is invaluable. Paediatricians see patients and families over a long period of time, and being able to access this kind of genomic testing contributes to holistic care, shorter wait times, and ultimately having more information sooner so that the family and the child can be better supported and more empowered. With benefits for clinicians, so paediatricians ordering this test are able to increase their skill and knowledge, get more information about how to target surveillance and management for the families that they look after. The other benefit that I really want to highlight is helping a family to choose the right time for testing. And so the focus of the talk today is on achieving early diagnosis, but that has to come at the right time for the family. So being referred to genetic services and waiting a year for an appointment and then having to take the appointment because that's when it's available doesn't necessarily facilitate testing at the time that is best for the family. Whereas if it's part of regular standard care, testing can be done whenever it is that is appropriate. And then I touched on equity of access earlier. The way that it benefits the entire healthcare system is that mainstreaming this test means that people from all over can access the test. Not to say that everywhere in Australia has fast or easy access to paediatricians. I'm very much aware that there are lots of areas where that's still really challenging, but more often it's easier to access a general paediatrician than it is a genetic service, just because of the numbers. And so families are then more able to access the testing, and then genetic services are also able to allocate resources a little differently so that they can focus on the children and families who are not eligible for this particular test, because as we've said, it's only for children less than 11 years. So for families that need more complex genetic input or who aren't eligible, or for those who have already seen a paediatrician and need a bit of extra support, this mainstreaming frees up genetic services a little bit. So what we've heard from paediatricians is that it can be a bit daunting to take on a new complex test. for people who are already facing large workloads that sometimes they feel can be in excess of what they have available to provide to the community. And we will get back to lots of resources that we have to address all of these concerns at all of the different steps along the journey. But before we do that, what we wanted to do is use a case to demonstrate some of what we've been talking about. So I'll pop up the case here, and this is really just a prompt for a discussion. And if we focus here on the information that we've got, this little chap is a 3-year-old who doesn't look like his parents, has severe developmental delay, and there's some detail about what that entails there. Put up a little bit of information about some of his body characteristics. And the thing I want you all to focus on is that his parents have come to you in whatever your capacity is at work, or if you don't work with families where this could be a possibility, it could be a friend or a contact who's come to you and said, look, this is what's going on for us at the moment. We're really wanting to find out what's going on and why so that we can help our child. How can you facilitate a diagnosis? So that's where we're going to hand back over to Sian. Thank you, Sian, for facilitating a bit of a discussion. So firstly, we wanted to start off by highlighting some really fantastic parent resources that are available. So as we said, Erin and I are part of Melbourne Genomics, and there's a whole suite of resources on the Melbourne Genomics website targeted at consumers, families, health professionals, allied health, you name it. There's really excellent links to information on there, and also pathways through to other fantastic websites and providers for information. I wanted to highlight a couple of things that are on there. So somebody mentioned going to see a pediatrician with concern so that you can talk about it over a longer appointment time and in more depth. So for families who are starting off or on their way through a diagnostic odyssey, there is a summary of some suggested questions that they might want to think about before they go to their pediatrician, which also has an accompanying list of things that the pediatrician might ask you so that you can have a think about it before you go, get together information if you need to, and also just have a think about what you're wanting to know from them and what you're wanting to get out of the appointment. The other resource that's really good is from the perspective of lived experience. So I'm aware that some of you in the room will know these two fantastic parents who have shared their insights for this resource. And this is a transcript of a conversation with a couple of parents who have gone on diagnostic odysseys with their children. And it talks about things you might consider when thinking about genomic testing, thinking about the timing of testing, what it can offer, what the drawbacks are, and if you're part of or supporting a family who don't have much contact with others who have a similar lived experience, this might be a really good place, among others, to start to make some connections and get some guidance from people who've lived the journey. So we're going to jump back into the case a little bit. And as both Libby and Em have mentioned, the first-line genetic tests that in our case a paediatrician had ordered, these tests can be ordered by a GP. So there is a really wide availability of these first-line genetic tests, which is really fantastic. It means that the search for answers can start early and should start early for everybody. The other thing that in this case had been done prior to the point in time that we're presenting was some brain imaging. So an MRI brain had been done. And all of these things were what we call uninformative, which means that they didn't give us an answer to the question of, is there a genetic cause for this child to be developing in the way that he is, with his unique characteristics that he has. So once those things are done, the next step in my mind is genomic testing, because if this is a child who's coming to see me as a paediatrician, I know that I have that test available to me in my toolkit. I'm going to share a resource that I have been part of developing with Melbourne Genomics, which is, it was built as a support resource for paediatricians, but it's able to be accessed by anyone. And it has lots of really useful information about genomic testing for childhood syndromes, including a step-by-step guide, some additional resources, and a service which is open to anyone in Australia where you can ask direct questions of a genetic expert who most of the time is a genetic counsellor. And I'll do a kind of brief cook's tour of the website with our patient in mind from our case, just to demonstrate how it can be useful. And for all of you in your different roles, personal and professional, you can have a think about whether any of this might be relevant for you or for people that you're supporting. So this is what our resource looks like. And there's a QR code there if anybody wants to get direct access to it. So we talked about the steps that are involved in undertaking exome sequencing previously with our little ladder that we had in different colours. All of those steps are now here on the side of our step-by-step guide. And so in the website, when you click on that, there's lots of information about eligibility. So, you know, if a family's thinking, oh, I've heard about this thing, I wonder if we might be eligible, you can go on. Allied health professionals, GPs, paediatricians can go on and go, okay, well, that might be an option. There's a bit of a checklist there. In terms of our patient, he is eligible. Something that a lot of non-genetic clinicians can struggle with is describing unique facial features and finding the right terms so that when they're talking to each other or referring to genetics, everybody's speaking a common language and has a common understanding. So what we've got is a link to some fantastic resources, and I've just pulled out some that are relevant here for our case, just how to describe some of the unique facial features that you're seeing. And so the resources that are linked in the step-by-step guide are research papers, but they're all presented in pictures. So it's super easy. You can scroll through the paper. It's divided by facial feature, so nose, mouth, etc. And you can just scroll through and go, do any of these noses look like my child's nose or my patient's nose? And then how might I describe that? So these are really widely applicable to families, allied health, doctors of all kinds. They're resources for consent. So there's videos, fact sheets, and some of this work has been put together by people who I'm recognising from our group today, which is fantastic. So lots of resources that people can take away with them, watch or read at another time, have a think about, and come back at a later stage if they're feeling it's relevant. So, something to point out in case people here aren't aware that doing genomic testing via saliva sample is really quick, painless, easy. It's a stable sample that can be sent in the mail, and certainly where I'm from in Victoria, our laboratory prefers to do testing on saliva samples. And it just makes it even easier and even more accessible. For example, people who find it difficult to get centrally for appointments or for pathology collection can all be sent home. Now, Em, I can see you've got your hand up.
I just wanted to make a really quick point that I think also if you're thinking about neurodiverse patients as well, and in fact many patients, even so we have a program GeneCall where we've been talking with people with intellectual disability and neurodiversity about genomic testing, and even a barrier to get to talk about genetics is people start getting worried about a blood test. And I think it's really underappreciated that you can do saliva testing, and in fact it may be even better for some types of neurodevelopmental conditions. So it's definitely worth talking to your local lab and seeing if they will do saliva testing, but also, I'm probably not being recorded, you don't have to send to your local lab. You can send to the lab, particularly if it's under Medicare, that's best for your patient.
Yeah, fantastic. Thank you very much, Em, for pointing that out. And this particular lab that, I happen to use all the time because they're located in Victoria, VCGS will accept patients from all around the country, and they will send kits to people all around the country and New Zealand as well. So they're very accessible. Not that you can do Medicare testing from New Zealand, but it's just another avenue. Okay, very briefly, a lot of clinicians are very hesitant to order new tests if they're not sure that they're going to be able to adequately interpret results. We've got lots of resources to help with that, including the Genetic Expert Helpline. Clinicians are very welcome to ring up and say, look, I've got this result. I'm not quite sure what it means. Can I talk to someone? And we can organise that from there, which is great. Back to our case for this sweet little man. So just so that everybody's aware, this is a doctored report. This is not a real report. So this has been made by educators at Melbourne Genomics so that it doesn't reflect anybody in real life. So can I get a show of hands for anybody who is not particularly comfortable looking at a report like this? And I'm expecting quite a few of you. Yes, okay, fantastic. So I'm just going to, going to go back to that. Sorry, this is me having some tech issues, making sure that I move everybody's faces out the way again. So that's really expected. I would say more than 90%, probably much more than 90% of families that I deal with, that everybody will be dealing with, won't have seen a report like this prior to receiving one for themselves. It's really confronting. It's very wordy, and it's not particularly digestible. So there are a whole lot of resources for understanding how to read a report, for generating a family-friendly report, so translating it into usable, patient-centered, friendly language. This is an example. So the reports are divided into the actual result, the particulars that you need to know, which is what's in the table, a little bit of a description of the evidence that is used. So that's research papers that are used to inform the result. And then the next page is all about how the result was generated. And something that I go through with all families when we're talking about the test is the types of results that might come back. The reason that this is highlighted here, the positive pathogenic result is highlighted, is because that's what was written in the report. And something that Erin had brought up before was about linking families to others with lived experience or having some information to take away. So in the results disclosure section, there's lots of info about where to find those kinds of things.